Hey, Fran.
Hi.
Thanks for taking time today to talk to us. Why don't we start with talking about your career? How did you get here? A little bit about yourself.
Well, it's a really interesting journey to share. So my background is epidemiology, and I started working with large non-governmental organizations, the CDC, World Health Organization, and then actually went on to work for the Department of Commerce. And within that environment, working directly with the data and the systems that analyze that data resulted in me actually moving, interestingly enough, into the biopharma industry. And in going into that space, I spent a lot of time in the middle, if you will, of two worlds. That is the technology and communicating about that technology directly to the key stakeholders and lines of business. And within that, just continued upon that trajectory. I guess you could, in many respects, say that I was at the forefront of a group of industry specialists who understood at the time both worlds. And as a result of that, I've continued down that trajectory of working in many capacities. Today, I actually am part of the global healthcare leadership team for HP.
So tell us about what is HP working on? What's the most exciting thing that you guys are working on from the healthcare industry perspective?
Oh my goodness, so many things. So if I think about it, I would say the biggest area of focus right now and how we sort of tried to simplify it is breaking into three areas, or three pillars, if you will, of care delivery, patient engagement, and population health management. Mm-hmm. And within each one of those pillars, we have begun to create some very exciting technologies. First, beginning with having this understanding of as to where we are as an industry. That is in terms of some of the necessities or the fundamental components of the quality, the reliability, the security, and the integrity of those systems. And so we've built sort of these guiding principles where we first began by creating these clinical grade devices that we are putting in the hands of clinicians, enabling the providers to be able to deliver quality care. And now we are at this space where we're really focusing in on patient engagement and population health management and doing something quite similar but in different ways. This is where we are essentially taking the technology and putting it in the hands of the patients. One of the things that we pride ourselves in is looking at the needs within the industry and recognizing that when we're talking about healthcare, we're not talking about entertainment as an example. Mm-hmm, mm-hmm. Whereas, if it's for entertainment purposes, then, if it stopped working, a device stopped working, then you might be inconvenienced, but you're not taking any risk. Your life isn't, mm-hmm. on the line as a result of it. So what we're really focused on is creating a high quality, commercial grade set of solutions that at the same time are delivering these really robust innovations. Everything from at the edge compute to immersive compute and the use of virtual reality technologies, as well as partnering with other solution providers, principally those being software developers, to introduce end-to-end solutions around areas like compliance and medication adherence, looking at how individuals can thrive in motion, if you will. These are the types of things that we've been looking at, and it's really, really exciting.
Interesting that you compare that to entertainment, right? Because mm-hmm. people are willing to pay for entertainment. People are not willing to pay for healthcare. Right? So there is a transition in the industry that's happening. Mm-hmm. Industry is almost in a chaos right now, from regulatory perspective, from political perspective. So what is your advice to executives in this industry? Like, how do you handle that level of and the kind of uncertainty that's there in the industry right now?
Yeah, that's a great question. When I think about it, I really see where for organizations, for companies, right, for businesses, to be able to thrive in this kind of environment, they've got to be willing to take some risks. Mm-hmm. And recognize where it is okay and where it is safe to take those risks. We spend a lot of time not only introducing these innovations, but also putting some rigor, scientific rigor, some evidence-based research around the introduction of our technologies. But if organizations don't get to the point where they're able to look around and say, I think this is an area or a space where we can afford to take some risk, to allow ourselves the opportunity to have learnings and to be differentiating, if they're not willing to do that, then in the future, quite honestly, they're just not going to survive. Because at the end of the day, regardless of how we are willing or not willing to invest in in healthcare per se, the consumer, the patient consumer, is looking for a certain level of experience. And what we are hearing is that the level of experience today is just not good enough. And that the reality is that the innovations that are being introduced are the types of innovations that are allowing for them to have the types of experiences that they want. Whether it's around getting access to medical information, being able to actually comprehend and understand what their providers, what their clinicians are communicating to them, whether it's around being able to better coordinate and have provisions and have support for the network of family caregivers that are going to be there to help to continue to deliver care for those individuals within their homes and within the community. Those things are happening and the technology is there. The question becomes for these executives, do they want to be a part of it or not?
Absolutely, and interesting that you say naturally kind of call them consumers, right? Got to start treating patients as consumers. That's the first step.
Yeah.
So what's the biggest challenge that you're facing in HP? When you are an innovative company, you always have been, your roots are in innovation. So given the environment right now, what's the biggest challenge that you guys are facing?
It's kind of interesting. We've got this sort of dichotomy. On the one end, we have these new innovations, new categories of technology that we've introduced. An example of that would be the HP Sprout technology, which is an interactive, immersive compute technology that's so new that it's taking a lot for the industry to actually come up to speed with what we're creating. And then we have on the other side, we sort of have the sort of existing technologies where we're really not about being a Me Too sort of company. We're really about, and our underpinnings have always been about creating value in the devices that we create. And in doing that, it's kind of about getting inside of the psyche of the individual, getting inside of the psyche of the facilities, as well as of the the consumers of that technology, to the point where we're able to introduce new technology in ways that they can easily embrace. And there's always that fine balance of giving them a little bit but don't give them too much. And then at the same time delivering it in ways that make it easy for those technologies to be integrated within the workflow, particularly within the clinical workflow.
Makes sense, makes sense. So how is CAST assisting or helping in your mission?
Oh my goodness. In so many ways, really quite honestly, in many ways. I think it was probably about 3 years ago that we became very active members of the leading age. And honestly, it's been such a blessing for us, in so much as it has allowed us to continue to extend our network and interactions with those key stakeholders who are really on the front lines in terms of the delivery of care to a very diverse population of individuals. And it's also allowed us the opportunity to contribute, to give. I have had the good pleasure of being able to sit on a few different task forces. I was super excited about the most recent social engagement. It was actually social connectedness and engagement technology research that was done, and being able to contribute to that. And I just look forward to doing more. Leading Age, they're thought leaders within this space, and they're doing great service for the community at large.
Fantastic. So let me ask you another question, Fran. What advice would you give to young executives who want to follow in your footsteps?
I think, first of all, it's not being afraid to take a zigzagged approach to your career. That would be the first one, right? If you think back on, if I think back on where I've been, everywhere from being in the non-governmental, the federal, I even was the director for heart disease and stroke prevention for the state of Tennessee, and yet I worked for biopharma for several years as an expat, and now working within a large, the leading technology manufacturer in the world. That's a zigzagged approach. I have mentored quite a few students in their MPH programs, and in that they always start off, especially when I say, my background, I'm an epidemiologist first, right? And they're like, wow, they're always thinking they're going to end up stuck inside a state Department of Health. That's their frame of mind and their reference. I think that's the only journey for them, and it's so not the case. There's so much opportunity for being able to apply within healthcare and within technology, the discipline of public health and of epidemiology and all these various areas of the life sciences. And even on the technology side, I've had the chance to look at individuals who have a pure technology background. They have, they're not really healthcare, and yet healthcare is a part of all of us, right? It's not something separate from us. It is us, essentially. Yeah. And so there's really opportunity for everyone to participate in this place where there's a convergence of healthcare and IT. There's just so much room and so much variety that really, the only thing that can hold you back is, is a limited mindset.
Yep.
So, yeah.
Thank you, Fran. Very insightful discussion. Thanks for taking time for sitting down with me today.
Yeah, for sure. It's been my pleasure. Thank you.